Hi, my name is Eleanor Zacharia. I'm a full-time student here at UB and a full-time RN at South Buffalo Mercy Hospital. This is my patient safety project on patient falls in the hospital. Thank you for watching, and I hope you enjoy. My patient safety concern is falls in the hospital setting. Why is this a concern in the hospital? All patients in the hospital are at risk for falls, not just the elderly. Procedures, medications, and unfamiliar settings are just a few of the reasons patients are at risk. According to the Joint Commission, falls have been reported as one of the top 10 sentinel events reported in the hospital, making it a prevalent issue that needs improvement. 63% of falls reported have resulted in death, while the others sustained injuries. Falls lead to longer hospital stays, decreased rehabilitation following an illness, and increased healthcare costs. Supporting evidence. Patient falls in hospital care settings are a serious health problem and can result in complications that delay discharge, decrease patients' ability to function, and increase healthcare costs. Falls with serious injury are consistently among the top 10 sentinel events reported to the Joint Commission's Sentinel Event Database, which has 465 reports of falls with injuries since 2009, with the majority of these falls occurring in hospitals. Experts estimate that more than 84% of adverse events in the hospital patients are related to falls, which can prolong or complicate recovery. Why do falls happen? Inadequate assessment by hospital staff, medical conditions, medications, altered mental status, physiological ailments, unfamiliar settings, communication failures, and untimely call-out response. How can falls be prevented? Patient falls are a preventable sentinel event. It may be prevented by adequate assessment. Upon admission to the hospital, each patient should be screened for their risk of falls. Each aspect should be evaluated, including medication regimen, cognitive status, and physical ailments. This assessment should be continued throughout the patient's hospital stay, as these aspects may change daily. A baseline screening should be obtained, and the patient should be assessed every shift thereafter. Fall precaution framework. After each patient is assessed and the risk for falls is determined, fall precautions should be implemented, meaning non-skid footwear, bed alarms, etc. While some patients are a higher risk than others, care should be taken in recognizing that each patient is essentially at risk during their hospital stay. Hourly rounding should be performed by both the nurses and the nursing support staff to ensure patient needs are being met timely and call-outs are being answered. Root cause analysis model post-fall. A post-fall huddle should be conducted to determine the root and cause of the patient's fall. An analysis should be performed in order to implement new strategies to prevent a fall in the future. Bedside education every shift. Educating patients on the risk of falls, enforcing the use of the call-out system, and explanation of the hourly rounding policy. These are just some of the interventions that can be implemented in order to prevent falls in the hospital. What do we mean when we say fall precautions? Implementation of the universal fall precaution includes identifying high-risk patients through the use of yellow non-skid socks and yellow blankets. Education should be provided to all staff in the hospital on the meaning of the color yellow. Therefore, a high-risk patient is easily identified by all staff. Use of bed alarms and chair alarms on those identified as high risk. Use of one-to-one sitters for those who are high risk, have an altered cognitive status, or consistently set off bed or chair alarms. Use of a standardized fall risk assessment tool included in the electronic medical record for each patient upon admission and every shift thereafter, and administering non-skid footwear, non-yellow, to all patients who are admitted even if they are not identified as high risk. This flowchart is an example of implementing the fall precautions by going through a basic assessment upon admission of a patient's fall risk status. Asking yourself these questions about your patient that you're admitting can help you determine whether or not this patient is a moderate fall risk, or a mild fall risk, or a high risk. How will this change be implemented? The aim is to reduce patient falls by at least 95% within 3 months of implementation. The way this will be done is through the PDSA model. The plan. Registered nurses are responsible for assessment of each patient upon admission to obtain a baseline fall risk. Include assessment in the electronic medical record. Requirement of reassessment every shift using the standardized fall risk assessment tool in the EMR. Development of a patient safety team of RNs within the hospital who will be responsible for data collection, policy enforcement, and ensuring that all units are stocked with supplies. This includes non-skid footwear, yellow non-skid footwear / blankets, and functioning bed and chair alarms. The safety team should be available to both the day shift and night shift to assure maximum patient safety and to provide education to staff at all times. Do. The RN assigned to the patient is required to implement fall precautions, including the use of yellow non-skid socks and blankets on patients assessed as a high risk. Implement the use of non-skid socks, hourly rounding, and bedside education universally on all patients regardless of their risk factor. Study. Evaluate the percentage of patient falls by each month. Each unit must fill out an incident report each time a patient falls. This data is collected at the end of the month by a patient safety team comprised of RNs within the hospital and evaluated based off of previous months. This team will assess if the new strategies are successful and where improvements can be made. Act. The patient safety team will determine the success of the changes based on the recorded percentage of falls per unit per month. If the changes reveal no success, the team will then huddle and come up with a new strategy and repeat the PDSA cycle. If the change is deemed successful, the team will enforce and evaluate the parts that were most successful. This process will continue until the goal has been reached and then will be maintained by the patient safety team. This concludes my patient safety project. Thank you for listening, and I hope you enjoyed.